I believe AIDS can be beaten, but only by eradicating its most deadly symptom, stigma. The shame of HIV still forces millions of people away from information and health services and into the shadows, where they cannot protect themselves or those they love. This show will look at 6 provocative stories that address how global societies must be willing to rethink well-worn social, ethical, and moral norms to end stigma. Our first stop is the Caribbean nation of Haiti, which has the highest prevalence of HIV in the Western Hemisphere.
In Haiti, 2 children are born with HIV every day. 20-year-old Venice Luis's parents died from AIDS when she was 11. Orphaned, she went to live with an aunt. Several years later, she suspected something might be wrong with her.
I was getting sick often, and they took me to get an HIV test when I was 14. And that is when they found out I am positive. And my aunt's boyfriend said that I cannot stay in the house because I would infect the other children.
Venice now lives at an orphanage run by the organization caring for Haitian orphans with AIDS, along with 18 other HIV-positive children. In Haiti, the stigma of being HIV positive runs deep. After her diagnosis, Venice suffered cruel mental and physical abuse.
My aunt's boyfriend told her to separate everything I used. Silverware, glasses, soap. I slept in a separate part of the house and I couldn't play with the other kids.
Each morning, Venice prepares for school with the other children. Her aunt would not allow her to get an education, fearing a cut or scrape would infect another child. At the age of 20, she is now finishing the 4th grade. When she first arrived at the orphanage, she was shy, withdrawn, and cried a lot.
I did not feel good at all. I did not feel like a normal person. And by the way my aunt treated me, I thought life wasn't meant to be good for me.
The children are given antiretroviral medication twice a day. Venice arrived at the orphanage weak and physically underdeveloped. After she was diagnosed, she begged her aunt to take her for treatment.
I used to cry a lot every day. My aunt told me the only way I'm going to get treatment is under the earth when I'm dead.
Eventually, Venice received sporadic treatment at a hospital. She also met with a psychologist about the abuse she was suffering.
They told me that if I did not do what they say, they will kick me out of the house. And I will be in the street like a prostitute sleeping with men, and they will not accept me back.
It was the psychologist who suggested she be placed in the care of the orphanage, and her life began to change.
When she started getting regular treatment, she started to gain weight. She started to get better physically and mentally.
Two of Venice's aunts agreed to visit her at our request. Her aunt Janesse denies that there was any abuse.
If somebody told you that, it is not true, especially when she was sick. We never abused her.
Venice remembers things differently.
If they say they did not do that, then they are lying, because they did.
Her aunts want to put the past behind, but Venice still harbors too much pain and anguish.
When I become older, I will let them know what they did to me was wrong. For now, I want to finish school, learn a trade, and never go back to live with my family again.
Although HIV and AIDS is now a treatable condition, a positive diagnosis is still a life-altering experience. In Cambodia, people living with HIV are often disowned by friends, family, and the community where they live. This humiliation can be unbearable, and severe cases end in suicide.
Each morning as Uknavi stands in front of the mirror, she glances at photos of her late husband and remembers the good times they shared. He committed suicide after learning he was HIV positive.
Before I suspect I made a mistake, he asked me if he had HIV, what would I do? I replied saying if you bring the virus to me, I would slit my own throat.
After her husband's death, Uknavi continued to live in her home near the Thai border.
Shortly after I held the funeral for my husband, I was looked down on and treated differently by the villagers. Children in the village started making fun of my son, saying your father had AIDS. He might have infected the whole village.
When villagers set her house on fire, Uknavi returned home to live with her sister near Phnom Penh. She was sick often, and a test revealed her worst fear. She was HIV positive.
My only sister and cousin showed disgusting behavior toward me before we ate together. But after I was known as HIV positive, they would not eat with me. Even when my child was playing around, they called him AIDS child.
Cambodia offers free medication for the country's 70,000 people living with HIV. But many must move from the countryside to cities for treatment. Those with little means live in squalor.
Almost 75% of them think they made such a big mistake in their lives that they discriminate and isolate themselves from society, and the serious cases end in suicide.
Feeling desperate and alone, Uknavi contemplated following her husband and committing suicide.
I felt so sick and skinny, and I no longer wanted to live. Then I thought of my son and took pity on him. So I strived to survive, just for him.
Though Uknavi found the strength to keep living, life was not easy. Her sister could no longer help her.
I just could not afford to feed her, as I have barely made ends meet for my two daughters.
Uknavi is now feeling better, both mentally and physically. She receives housing, food, and medicine from Place of Rescue, a Canadian organization that supports people living with HIV. It is her son who brings her life purpose. But her thoughts often wander to her late husband.
I feel anger and regret every day. If only he was still alive, he would have received medicine and felt healthy like others with the disease. He shouldn't have been so short-sighted and decided to kill himself.
In Uganda, an anti-homosexuality law criminalizes same-sex relations, which is now punishable by life in prison. In Nigeria, same-sex couples that show affection in public risk 10 years imprisonment. Both laws are forcing communities vulnerable to HIV deeper into the shadows.
Jesus has paid for God's kingdom.
In Uganda, religion is used as a weapon against homosexuality.
Don't decide tomorrow. Tomorrow might be too late for salvation. Homosexuality is prohibited here in Uganda. We don't want it.
You get people, these mobs of people who are protesting, who are screaming, kill the gays, death to the gays. But it's not really about the gays, it's about them being frustrated with their own lives, and it's about the scapegoat, and it's about the government using gay people as a scapegoat.
Tell us not to stop the fight to protect our children from sodomy.
In Africa, homosexuality is against the law in 37 countries. The movie God Loves Uganda documents the influence of American evangelicals on anti-gay policies in Uganda.
American fundamentalist evangelicals have targeted Uganda for decades. And Uganda was a perfect storm because it was decimated, had the highest rate of HIV and AIDS in Africa. And so American evangelicals saw an opportunity and they moved in.
My goal is always to discourage sexual promiscuity of every sort. I believe that governments, all the governments of the world, have an affirmative duty to promote the natural family and marriage as the mainstream culture.
There is all of those things that is not God's way for love.
In Bible study classes like this one, they teach the belief that God does not love gays.
Nigeria and Uganda now are producing these pastors that were raised on this sort of idea that, you know, biblical law is above civil law. So what you're seeing now is the results of 30 years of American evangelicals being involved in the country.
In February of 2014, President Yoweri Museveni signed a bill outlawing same-sex relations in Uganda.
At best, it's paternalistic colonialism. At worst, it's outrageously racist to suggest that the Africans are children who cannot make up their own minds about what morality their country should follow.
A similar law was passed in Nigeria. Afani Arazuliki runs a clinic providing healthcare services for gay men in Abuja, Nigeria. 17% of gay men in Nigeria are HIV positive.
We can't keep quiet for people to die or for people to lose their life. The law, on the other hand, we are battling the law because even people like us stand to go for 10 years imprisonment for doing what we're doing. Bobby, how are you?
Today, he is investigating a hate crime against a young gay teenager. Health officials in Uganda and Nigeria believe the new anti-gay laws will somehow lower HIV infection rates. Afani says the laws only promote violence and fear.
Ever since that night, the mobs attack, life has not been the same any longer in this community. You know, the beating, you know, they seized my phone. They came to attack.
Before the law, 15 new patients walked into his clinic every week. Now that number is down to 4.
The world is saying we want HIV/AIDS-free generation. We can't achieve that without including men who have sex with men. We can't achieve that without involving transgender people.
Nigerian officials say no one is being denied health services because of the law.
Where the law is concerned is when gays would go and congregate and show that we are gays and we are making love on the street and all of that. The law frowns at that. And treatment for any kind of disease in Nigeria is open to all citizens, irrespective of their status.
You cannot walk into a clinic, you cannot get drugs if you're HIV positive in Nigeria. It's nearly impossible. You are so restricted, you are so stigmatized, you are so discriminated against by the healthcare industry. So for him to say that is crazy.
Undeterred, Afani presses on.
When I wake up every day, I want to do more. I want to see people smile. I want to see equality that is achieved across board in Nigeria someday of our life.
Afani is absolutely a hero. I think it's very hard for people in the West to understand exactly what he's up against, the hostility and hatred that he's up against, and that the fact that he refuses to back down and goes into the fire and faces it is unbelievable, unbelievable.
In Washington, D.C.'s gay African-American community, stigma and fear are keeping many from confronting the crisis. We follow Christian Page Bass, a young gay HIV-positive man who had his own fears about seeking treatment, as he encourages other gay men to seek health services.
You got it. Always saying the dream like he just did. I really love to sing. I think God gifted me with a talent to be able to use my voice to sing.
Christian Page Bass also likes to raise his voice with a message of inclusion.
We don't like to call ourselves a gay church. We call ourselves radically inclusive because we have transgender and we have straights or heterosexuals as well that attend the church. But I love it.
But the small town in North Carolina where Christian grew up was far from inclusive. In the southern U.S., conservative values are strong.
Didn't know what gay was because the word gay was never used. The word mainly was faggot. That was the word. I didn't know anything about gays. When you're going to be a faggot, it's not you're going to be gay, you're going to be a faggot. Or you are a faggot. And I don't like that term.
In 2001, both Christian and his mother, an intravenous drug user, were diagnosed as HIV positive.
Thank you.
When she died, 5 years later of complications from AIDS, Christian was gripped with fear.
I looked on the dresser, and she had already started doing her pill box for the next week. And I looked at those pills, and I remember thinking, this is going to be the death of me. And from that day forward, I didn't want to take any more pills.
In need of a change of scenery, he decided to visit some friends in Washington, D.C.
I came to D.C. and I loved it. I seen all the gay people. I just was like, I want to stay.
The big question is always, have you missed any doses in the last 3 months?
A change of scenery also changed his views of his treatment. He met Justin Goforth, a nurse practitioner at the Whitman Walker Clinic.
He was really resistant to the idea of starting treatment for HIV.
It recently broke. And
I think that he had a lot of really emotional baggage around his mother dying of HIV and the huge number of treatment and pills, really, that she was taking when she died, and now has become an advocate for people being on treatment.
Christian's advocacy has made him a regular on Washington's gay club scene.
Going to the club is work. I've had people come up to me and say, do you have a number, or do you have an email? How can I get in contact? I want to talk to you because I was just diagnosed, or I'm dating somebody that's positive. They're there for the moment, and then they're going, and they'll call me when they need me, or they'll text me when they need me, but we keep in contact.
Christian works as a part-time model.
When I got diagnosed and the doctor told me I had 2 years to live, I wanted to make sure people realized that you could take your medication and still be healthy and still look good and still be nice. You can live long. You don't really see AIDS patients like you used to in the 80s. You use the word AIDS and everybody's running. Use the word HIV, people will stay. Use the word I'm positive and nobody's going to move. But you use the word AIDS, it's like turning the lights on and the roach is running.
Insight is a supervised injection facility on the worst block of Vancouver's heroin district. Here, nurses give clients clean needles to inject illegal drugs. Researchers have proven the facility is effective at cutting HIV infection rates in the area. But critics argue Insight only promotes illegal drug use.
Vancouver, Canada has been called the jewel of the Pacific Northwest. But there is a darker side to Vancouver. More than 4,000 intravenous drug users live in the downtown east side. The alleyways around Hastings Street are open drug markets and shooting galleries.
This alley has a lot of memories.
Former addict Richard Teague has been HIV positive for 24 years.
When you're an addict and you want to get your hit into you, you go to the closest spot. And this is it, this alley right here. You know, you want to, get your fix in you, and you didn't want to wait. You wouldn't wait, try and find a room. You went to the nearest place where you could be kind of out of sight, and do your fix and get your high.
The community responded by creating Insight, North America's first supervised injection facility.
When people are seriously addicted and their goal is that they're going to use the drugs irrespective of what we say, your focus then becomes on, if you're going to use this drug, how can we do it in a way that is safer, reduces the risk of infection, reduces the risk of getting significant wounds, reduces the risk of actually this individual putting demands on other aspects of healthcare.
Insight has 12 injection booths, where clients use their own illegal drugs under the supervision of healthcare professionals.
Water here, which is sterilized.
Clients are provided with clean needles, pure water, and supplies to clean wounds. When Richard was using heroin, Insight was his safe haven.
I know Insight's been a godsend for Vancouver and for a lot of people, because I know some weeks at Insight, they probably saved 10, 15 people from ODing.
One of the things we have done significantly is the growth in new HIV infections and Hep C infections has receded significantly. I think for HIV, we're probably somewhere in the region of about 70%.
But Insight has its detractors. Prime Minister Stephen Harper and Conservatives in Parliament want the facility closed.
There have been multiple studies on these types of institutions like Insight in Canada or others in Central Europe. And some suggest there are public health benefits. Others suggest there are significant public health detriments in terms of increasing rates of addiction.
Dr. Julio Montaner says that healthcare professionals who created Insight were skeptical that it would reduce HIV infection.
Time and time again, the data came in saying, yes, it helps, and no, none of the concerns that me and my colleagues and the community at large have expressed had materialized.
Today, life for Richard is about balance and serenity.
Well, you know why I like this park? The reason I like it, as you can tell from just looking around, it's very serene. For me, it was a break away from the street scene, being in the back alley, beside a dumpster. I still deal with stigma because of my HIV, and I've been very open about it. But best advice that I can give somebody is you have to have a tough skin. I can't change it. You can't change what happened. You just got to learn to live with it.
19-year-old Maurice Williams is now willing to come forward with the truth. Born HIV positive, he kept his status secret all his life. If Maurice had been born today, his life might have turned out differently. A trio of doctors in the United States has created an aggressive therapy of antivirals that can force the virus into remission at birth.
Dr. Deborah Prasad is passionate about the prospects of a medical breakthrough. and there seems to be new hope for babies that are born HIV positive.
We're on a mission to find a cure for AIDS, but this is going to be a very long road.
Doctors Persad, Gay, and Luzuriaga are the trio that put an HIV-positive baby into remission for 26 months. The New England Journal of Medicine published their research last year, but new evidence indicates the baby has tested positive. Dr. Persad believes early drug treatment has far-reaching implications. Implications for people like Maurice Williams, who was born HIV positive. Maurice is getting regular checkups at Children's Hospital in Washington, where he was first diagnosed.
Try to look straight at me.
The first time I found out that I was HIV positive, I was 13, I was in the 7th grade, and I found out because I refused to take my medication unless I knew why I was taking medication.
He was raised by his grandmother, who never revealed to him he was HIV positive. Maurice's mother died from complications of AIDS. She never talked with him about the virus or his condition. His mother was only a child herself when her son was born.
My daughter was 15 at the time that she had Maurice, so I stepped in and took over because she's afraid of needles.
Growing up, I was very angry with her for a long period of time. But I changed my anger around when I found out the anger wasn't beneficial to me. It turned into empathy. Because my mother wasn't even strong enough to really, accept the fact that she was HIV positive.
Go to a restaurant and then gaze into each other's eyes.
Maurice is pursuing a career in theater arts at a university.
I feel like people put AIDS in a box. Clearly, AIDS isn't a death sentence anymore as it used to be.
Maurice is giving support to HIV-positive teenagers like Shani.
Make sure you put all your effort in it.
His counselor, Melissa Selavag, has encouraged him to be a mentor.
Give it all you got, but try to aim for the middle. Shawnee is 13, and 13 is the age where I found out that I was diagnosed HIV positive. And I didn't have anyone older than me or even anyone of my own age that I can relate to help me, tell me that taking medicine will get better. Talking to him, it does more for me than maybe he even knows.
Dr. Persad is meeting Maurice for the first time, where she can put a face to the people she's trying to help.
So we have a lot more work to do where it becomes a disease that's living with cancer or diabetes or any other chronic illness, because so many people are affected.
I may not be the person who changes the world, but I want to inspire the mind that does so. I believe that I can be great. I believe I can live a long life. I wasn't supposed to be here now.